I'm now joined by Maddie, Groom, Professor of Neurodevelopmental Conditions and Course Director for the MSc in Mental Health Research and Practice. Welcome. So why is this course in mental health research and practice so relevant in today's society?
Well, in today's society, we've seen a massive growth in mental health needs and difficulties, and it's a core government focus, both in this country and internationally. So our course is preparing graduates for future employment in both research and clinical practice within the field of mental health, which is going to be important for many, many years to come.
And what are the sort of backgrounds of students who have previously studied this course come from?
So students tend to join us with a background of an undergraduate degree in psychology. We also have some medical professionals joining us, psychiatrists, for example. And we also offer the course to medical students who are seeking to intercalate the masters into their medical training.
And, you know, as you previously mentioned there, this is a really big area of growth in the UK. So what are some of the major topics that you teach that you think really stand out?
So we have a couple of really core strengths at the moment, one of which is around neurodivergence, so focusing on neurodevelopmental conditions like ADHD and autism. So I lead the Centre for ADHD and Neurodevelopmental Disorders at the Institute of Mental Health. This is a huge area of research for us. It's an internationally recognised centre, and the research that we do informs our teaching in that topic area as well. So another core focus is in the area of clinical psychology. We're very fortunate to have the Doctorate in Clinical Psychology programme within our department, and some of the people who deliver that programme also teach a module on our master's course, which is perfect for equipping our students for a future career in the area of clinical psychology.
And as part of this course, students will take part in a research project. So can you tell me a little bit more about that, what they can do, and some of the topics or methods that they choose?
We have a really wide range of different topics for them to choose from. This includes neurodevelopmental conditions, ADHD, autism, Tourette syndrome, mental health conditions like low mood and anxiety, psychosis, self-harm. Basically, all the research areas of our staff are topics that we can offer research projects within. We also have a really wide range of methods expertise, including neuroimaging, cognitive psychology, and qualitative methodologies like interviews and focus groups, which enable people to get into the heart of mental health difficulties and how they impact people. We also have really strong focus on involving public and the patients in our research practice, and students learn about this focus as well across the master's course and also in their research projects.
And in terms of career paths, what are some of the jobs that recent graduates have undertaken after completing this course?
So most of our graduates, I think it's fair to say, want to go on to study the Doctorate in Clinical Psychology. They aspire to be clinical psychologists in the future. That's a highly competitive programme to get onto. So the Masters helps to equip them for that and prepare them for future study in that area. And many of them go on to secure jobs as assistant psychologists or mental health support workers, all to try and gain that experience to move on into clinical psychology in the future. We also have quite a few graduates who want to complete a PhD, so they might take a research assistant position while they look for funding to do a PhD studentship, and lots of them manage to secure funding to stay with us to do a PhD as well. So lots of different avenues for people to go into, but I would say clinical psychology and a PhD by research are the two main focuses for our graduates.
And as you say, this is, you know, an area where research is so important, it's ever changing. How does that influence the teaching that you deliver on this course?
The vast majority of our staff are research active as well as teachers, and they tend to use those changes and developments in their own research to inform their teaching. So we change our lecture slides every year, and we make sure that everything is at the forefront of what's happening in the real world.
And this course, if you have students coming from different parts of the world, how are they supported, and, you know, how can they really achieve on this course?
So we really encourage international applications. We enjoy having international students join us. They bring a diversity and wealth of experience from their own countries as well. And what we tend to find is that over the years we've introduced additional teaching on global mental health into our programme, and students really value this. It helps them understand how things vary from country to country. And when international students either stay in this country or return to their own country, they're able to implement what they learn from the programme into their own context, their own international context as well.
And what is it about the University of Nottingham specifically? Why should students come and study this course here?
I think this course is relatively unique in the focus that we have on both research methods. So we teach our students to a really advanced level of research skills and expertise, and also really teaching them about the core knowledge they need about different mental health conditions and current evidence-based practice in assessing and treating mental health conditions. So that combined focus on clinical practice, evidence-based and research means that they're then really well positioned to be future researchers and practitioners.
Well, thank you so much for joining me today.